Today, I'm talking with Dave Wessinger of PointClickCare. I'm here with Dr. Trish from Imagine Pediatrics, talking again with Dr. John Showalter of Linus Health, talking with Kent Dix, the CEO of Life 365. I'm talking with Dr. Lior Rauschberger of Gene by Gene. I'm Nathan C., and today I'm talking with Dr. Colin Banas of DrFirst. Hello and welcome to the Health Tech Glow Up. I'm Nathan C., and today I'm talking with Dave Wessinger of PointClickCare. Dave, thank you so much for joining me today.
Happy to be here. Thanks for having me.
How's your health been?
Health has been very good. Not sure exactly why that is. Maybe I'm doing a lot less than I should be.
As a CEO, that's often the way to unlock a whole new era, so let's hope it is. Awesome. So introductions first. Can you share a little bit about what you do at PointClickCare?
I sure do. It's very easy because I am the CEO, which most people would wonder what a CEO actually does. But I lead our organization, and we are focused on having a meaningful impact on healthcare. And our mission is to help every provider deliver exceptional care. And that's what we wake up and think about and drive the team towards every day.
Can you dive in a little bit more specifically about the way that you help enable that kind of care?
Sure. So we're across healthcare in a variety of ways. I think if you think about long-term and post-acute care as an area of healthcare, we are the technology that runs their business. So clinically, financially, connectedness, working into the acute care, and we have the largest care collaboration network in the country that pulls information together to largely help clinicians get better information about the people they're caring for and deliver that in a way that can be used effectively.
A platform not just for tracking the care side of a healthcare business, but also tracking the business and making sure that whether you're on the care side or the business side, that you have the information and data you need to make good choices?
I think what we do is we bring the whole ecosystem together because it's not one segment of the market that all of us need to come together to deliver really good quality care for the patients that deserve it the most. And largely ours aren't there to advocate for themselves. So the more information we have, connecting payers, providers, health systems, all of the above, families, to make sure that we provide dignified care.
How does a tech platform enable centering the consumer and the patient in a way that you described?
I think there are traditional EHRs that are, and we think about that as just data. What we do is we bring it to life and we pull information that allows them to understand that patient in real time and know what should be done next. Where are the opportunities, where are the challenges, even predictive risk indicators. So we really give them information to understand they're moving very quickly. They have a limited amount of time. And the more we can put in front of them to know what to do and when to do it, really act versus spend time in the chart, we give them more time back at the bedside. And so that's really how it comes to life.
Do you have a metric for the value of doctor time saved or doctor time in the room saved?
Interesting. The most of those that use our system are clinicians, RNs, RPNs, CNAs. And as a result, the physician is at the top of the pyramid, probably the least amount of time. And so they are the ones that drive a lot of the care and a lot of the activity. And so the time is really saved with the RNs, the RNAs, and the CNAs in terms of less time documenting, more time doing.
So the people that need to explain to the doctors what's up, we're saving all of their time.
Yeah. So in the end, you could take something like an admission and say, we can take that process from 2 hours down to 10 minutes. Meaningful difference for all of those involved with really good med reconciliation that otherwise wasn't something we could do without the connectivity we have today.
If you can take any step of my healthcare journey and make it into a 10-minute task, I am there. We got to get to some of the questions for the show. The show is called the Health Tech Glow Up. A glow up is a dramatic transformation or reimagining. What's the glow up that you want to see happen in the health industry?
Great question. I think the thing I think about the most is the crisis working towards us, which is a limited number of staff available to do the jobs we need them to do, which was probably going to be caring for us at some point, if we're lucky. And so I think about how do we affect that? How do we make this a great place for people to work? And my glow up is get to a point where we deliver technology in the form of ambient tech, less time doing, more time information, that touch the CMR, EHR, where largely as you do and communicate, information goes in, It's structured well enough to understand what to go do, and is a place that people want to work and want to stay in their job, reduce the clinical administrative burden, and make this a place people go to school for because it's AI proof. You'll always have a job in healthcare.
Oh my gosh, we're going to glow up the healthcare industry so people actually want to use the tools.
They won't even know they're using a tool.
All right. And for PointClickCare, what's a similar glow up that you're looking to make in the next 6 months?
I think it's, in fact, as we all look at AI, what I think the biggest difference is not just looking at AI, but where AI can actually have a meaningful impact in terms of value. And we look at in terms of how we put clinician in the loop, not human in the loop, clinician in the loop to help them make really good decisions about the person they're caring for in the moment. And that is going to literally the value we're all going to bring, PointClickCare specifically, in the next 2 years will be 10 times what we've delivered in the last 25.
I don't want to drop the mic, but I feel like we need to. That's amazing. One more question. The theme is heroes and legends. I know that every entrepreneur has had at least one hero or legend who said, I believe you. I think you can do this. Keep going. I'm curious, is there a hero or a legend who has helped you get to where you are today in your career?
I'll speak to two of them. One, I look at heroes, and the reason we get up every day is the people we get to support in the workforce, the healthcare heroes that show up and do really difficult, challenging jobs every day. And they're absolutely 100% my hero, or a full team's hero. And that's why we do what we do. The second one, though, and I hate to call her a legend, she's still with us, but I started this business with my brother and my mother, and she's the hardest working person I know. She's a phenomenal, wonderful woman, and I got to call her out as a legend in my own time.
Amazing. I have to say, not the first mother or mother-in-law given a shout out for the health tech blow up this week. So
I love that.
amazing. This one's for you, Mom. Dave Wessinger, PointClickCare CEO, bringing the kinds of data both to practitioners and to patients that helps them get excited about their touch points in care.
I love it.
Dave Wessinger, Maha, and all the rest. Dave Wessinger, PointClickCare, thank you so much for joining me on the Glow Up, on the Health Tech Glow Up.
My pleasure. Thank you very much for having me.
Awesome. We got one more thing to do. Was? Thank you. So, 1, 3. Hello and welcome to the Health Tech Glow Up live from Health 2025. Today I'm here with Dr. Trish from Imagine Pediatrics. Dr. Trish, thank you so much for joining me today.
Thank you for having me on your show.
Amazing. So first off, can you briefly explain what you do at Imagine Pediatrics and your work there?
Absolutely. So at Imagine Pediatrics, I served as the Chief Medical Officer, and I oversee a team of clinicians, social workers, behavioral health specialists, you name it. It takes a village to care for the kids that we care for, but oversee a team that cares for children with special healthcare needs. And we do that through our virtual first and in-home care model. We are tech-enabled, so we like to really use technology to support our clinicians and support the families and the kids that we take care of.
Super quickly, can you dive in just a little bit about how you're using technology to help kids with these complicated diagnoses?
Yes, in so many different ways. First and foremost, we have a digital platform that our patients can engage with us over. It's a proprietary app that they download. They can do surveys, chat with us, complete a various array of testing that they can send in results through, or they can do videos, you name it. So it's a really, I think, in this caregiver generation, parent generation, they really like the tech enablement, which gives them that sort of immediate access. And so through our platform, it's just a really easy way for them to get a hold of a physician, get a hold of a nurse, get a hold of somebody who can manage whatever issue they're having right at the point of care, not having to wait. Medicine is so reactive. I'm sick, I'm calling, I'm waiting for somebody to call me back, I'm waiting for an appointment, really giving people this real-time access. And then we also empower through the data that we're utilizing to understand who our patients are, be proactive. Again, a lot of it's reactive. People don't have information about that patient they're seeing in front of them. They don't know what their needs are. We're collecting a ton of data to make sure we understand their needs and where we have to lean in, where we need to support from our different care team members.
So the show is called the Health Tech Glow Up, and a glow up is like a reimagination or a transformation. I'm curious, for the health tech industry, what's a glow up that you're looking to see this year? What's a glow up that you're looking to achieve in the next 6 months for your work specifically?
Really just getting better about being that point of access for patients when they need it. We are scaling quite a bit over the next year in Imagine Pediatrics. So we've started out in one state. We've got 2 states, 3 states, and moving to up to 3 or 4 more just in the next 6 months. And so really getting to that scalability, both through technology and then also through building a really amazing workforce of clinicians and team members who want to care for these kids.
And I'm sure learning through each new state and
Yep.
system and,
They're all
complications. The theme this year at Health is Heroes and Legends. And I'm curious, is there a healthcare hero or mentor that has influenced your work and helped you get to where you are today?
So I was a big fan of Sanjay Gupta growing up. My parents used to joke that when you grow up, you could be the Sanjay Gupta of healthcare. I think it's getting in front of people and talking about medicine. There's a lot of disbelief and bad information out there in general. And I think being able to be in front of people and talking about medicine, talking about the truth and giving them real data to reflect on is just really important.
Oh my
I
goodness.
affected.
This is the first time I've ever heard anybody endeavoring to be the Sanjay Gupta of anything, but I love it. So, Dr. Trish, I always love to make sure that people know how to follow up with the amazing organizations. How can people learn more about what you're doing?
You can find a ton of information about Imagine Pediatrics on our website, and that's imaginepediatrics.org. Or please feel free to connect with me on LinkedIn, Patricia Hayes, or any of our care team members. We love to talk about what we do and really work to spread the information about the importance of doing pediatric healthcare and doing it well and getting to as many kids as we can. So reach out.
Amazing. Thank you so much for the work that you do and that wonderful mission. And thank you for joining me on the Health Tech Glow Up.
Thank you for having me.
All right, we're going to clap it off. You ready? 1, 2, 3.
Since our last visit, I fixed my mom, so that was good.
Hello and welcome to the Health Tech Glow Up from Health 2025. Today, I have the extreme pleasure of talking again with Dr. John Showalter of Linus Health. Dr. John, thank you so much for joining me.
Thank you for having me again, Nathan. Excited to be back.
Dr. John, for those who haven't had the pleasure to chat with you in the past, can you give us a little bit of a quick introduction about who you are and what you do at Linus Health?
Absolutely. I'm the Chief Operating Officer at Linus Health. I have responsibility for most of the internal work in the company, but I'm also an internal medicine physician. And I focus on dementia care, dementia prevention, and helping people and families of people that have cognitive impairment.
Amazing. I remember last year when I talked with you on the Glow Up, you shared some advancements in dementia care and Alzheimer's that were really starting to get exciting. One of the things that everybody on the audience in the Glow Up says is they always want to hear about the follow-up. So I'm curious, in the last year, do you have any news to report on your Glow Up from last year's health episode?
I had just started using the Linus technology in my own clinical practice.
Amazing.
I hadn't really seen that many patients using the technology, and so now I have a year under my belt of seeing patients, doing the cognitive testing, finding things super early, and helping people. And I am totally shocked by how many people we've been able to actually make better and then support their families. So if you identify cognitive impairment early enough, and here's the shout out, check your brain, know whether or not your brain's working the way it's supposed to, because we have all kinds of mounting evidence that if just like cancer, if we find cognitive impairment early, there's more we can do. And we can actually add years to people's independence if we find it early. So like I had a patient who had to retire because they couldn't think well enough, and we fixed their sleep, and they went into the 2-week overseas mission doing the job they had to quit. And so just let that one sink in. So this whole thing where like dementia is inevitable, we can't do anything about it. Like I have a whole string of patients where really that's not true. And then a whole number of families where we caught it too late.
There wasn't a lot that we could do, but the understanding from the technology of what's going on in that person's brain and giving that to the family so they actually know how to interact and how to increase the quality of life for the time they have is huge.
I can only imagine, right, as a practitioner and as a chief operating officer for a technology company, to have that year's worth of data in your brain and like inspiring, educating the work that you do, how much more that could both inspire and push you to do more. Yeah.
Yeah, so that part's crazy to have a technology that I use and I see the benefits of and then go out to try to sell in the scale and have no reservations whatsoever about should you do this. My first patient was my mom, and she was one of the people that like is doing so much better. So I have permission to talk about her. She was just supposed to be the first patient through to make sure I could bill. The clinic worked. Unfortunately, she didn't pass the test. And I had no idea. She had no idea. Apparently my dad had some ideas, but she's now treating her diabetes. She's lost over 50 pounds. She took up piano and started playing piano. We got her a bed so she's sleeping better. And all of her tests are normal. So like prevented dementia in my mother. So I 100% want everyone to do this.
If you track your brain health, there are things you can do today to reverse some of the things that can happen when your body gets out of whack. That's amazing.
Yeah, as far as since our last visit, I fixed my mom, so that was good.
So, John, let's look at some other glow ups. What else can we fix? And let's start with the industry. Is there a dramatic transformation that you'd like to see in health tech and healthcare?
The ability to skill up the workforce, right? So we're not going to be able to meet the overall demands for physicians. If we can get nurses to be able to do more, medical assistants to do more, social workers to be able to do more, it's going to make a huge difference in the workforce. And I think AI is absolutely set to skill those people up.
I appreciate an AI efficiency for value and impact, not just for dollars. And like more care, more time for the workforce, more is just fantastic. What about for Linus Health? What's a glow up? You've already had a pretty good year. How are you going to top this next year?
So Linus on the commercial side has a whole bunch of glow ups happening. We're currently at 17 health systems when we were at 0 2 years ago. So that's awesome.
That's huge.
Yeah. So the product, the technology, the infrastructure that we're providing is definitely getting recognized. But I think what's really exciting is we just launched our Anywhere product, which means that it's platform independent, it's able to be done in the home, and it's completely accessible. Primary care doc could make neurocognitive assessment available to all of his patients, and the current wait time is about 9 months for that today. So going from 9 months to I sent you an email, huge. So that's a huge glow up for what we're doing.
Gonna take a 9-month process and turn it into an email. So good. The theme for the show this year is heroes and legends. And I know that every entrepreneur and every doctor has had some legend or hero or mentor who's pushed them, who's believed in them, who's seen the spark and got them, helped to get them to where they are today. Is there a mentor or a hero that drives the work that you do?
I do the work that I do today because of Dr. Abendroth, who was the CIO at the University Medical Center at Penn State, so the Penn State Medical Center. He was a pathologist, and I was a kind of lost kid that wasn't even sure what I wanted to do. I actually hadn't even applied for residency because I was completely floating. I think this informatics thing is for you. When I set up a fellowship and spent a year designing an entire training program around just what I wanted to do, and I got a master's in information systems, and because of him, I got this amazing opportunity to be on this total EHR AI ride that without him, I'm still not sure what I was going to do.
Amazing. Giving both encouragement and direction, and now such a great target for decades of innovation. That's so good. Dr. John, one last question. Do you have a healthcare hot take?
So I think my biggest healthcare hot take right now is lifestyle, which is not really a novel hot take, but importantly, the US pointer study came out, which validated the European finger study that showed lifestyle prevents not only cardiovascular risk, but dementia risk. And it doesn't involve any pills, and it's all stuff that you can take charge of and do today. So lifestyle medicine is my hot take. Not novel, but super important.
All right, you heard it here first. Health 2025 with Dr. John Showalter of Linus Health. Thank you so much again, John. Congrats. What a fantastic year of glowing up.
All right, thank you so much. Hopefully there'll be more to report next year.
Can't wait. And you're booked.
Thank you.
Hello and welcome to the Health Tech Glow Up. I'm Nathan C., and today I'm talking with Kent Dix, the CEO of Life 365. Kent, thank you for joining me today.
Thanks, Nathan. I appreciate you having me on.
Amazing. So this is our first time meeting. Can you introduce yourself and the work that you do at Life 365?
Absolutely. Like you said, I'm Kent Dix, CEO of Light 365, and our mission is actually connecting people at home to their doctors remotely. It's especially getting incredibly important with AI and also the fact that we're getting older at a rapid pace and we're losing physicians and care providers. So technology is going to play an important role in all this.
Can you talk a little bit more deeply about how the technology connects patients with their care team?
Sure. We tend to interface to over 1,000 different devices, which you don't need 1,000 different devices. But it's important when you're going around the world and you have devices throughout the countries that are out there because different brands, different manufacturers, but scales, blood pressure, pulse oximeters, glucometers, a lot of things you'd find in a patient's home. You can go to Walgreens or Walmart and you can get devices that have cellular or wireless technology on them. They connect to your phone or they connect directly to the cloud, be able to take the data that's on there, whether it's weight or blood pressure, and send it back into the cloud for your doctor to see it.
Amazing. And how do patients learn about Life 365 on their own, or is that something that doctors use as a platform and share with them?
So we sell directly to enterprises from that. So large healthcare enterprises, so health systems, health plans, system integrators that are out there. We're an active partner with Microsoft. I'm out there on their Fabric side of it and starting to work with some major consulting firms to help their clients get connected as well. The large enterprise players are now becoming under value-based care. They're also under population health as well. So they're either trying to reduce cost, increase revenue, or be able to fill care gaps that are out there and also increase their star HEDIS rating. So they're going to use AI in this going forward. It's no longer a buzzword. It's no longer a hype. It's here to stay. From that, it's causing trillion-dollar industries to come about with it. And AI is very much needing to have the observational data coming from the patient's home. We have electronic health records that are out there.
Yeah.
Right.
But those are just like when you go to the doctor.
They are. So they have the electronic health records. And a lot of times people will go, oh, doctors don't need any more data. They don't need any more data. But AI is very thirsty for it, right? It needs it. It can consume it within milliseconds. The data that's in the EMR, EHR is learning data. So I always give an example. You can use the EMR data or the genomics data or the claims data. But let's just say Kent Dix has congestive heart failure, God forbid, from that. My records would tell me anytime that Kent, his SpO2 or his oxygen gets below 85, his weight goes up by 4% overnight, or his blood pressure gets above 180, he's going to head to the emergency room in the next 7 to 10 days. They don't have, that's the learning data, right? They learned that, but they don't have the observational data coming from home. Like, where's Kent today? So it's missing a big data.
So you can like triage maybe why it happened, but you can't actually get in front of it or actually be engaging with care before there is that event.
Absolutely. We work with ambulance companies, and ambulance companies right now get probably reimbursed 40% of their rides because 60% of them are not reimbursed because it was either social determinative of health or it was an unnecessary transport to the emergency room from that. These ambulance companies now need to move to be fast response teams. So they know 7 and 10 days in advance of what's going to occur and they intervene before it happens. Concept, right?
There feels like it could be a little bit of a security and monitoring ick of do I actually want the ambulance company coming to me before I feel bad? Do you have thoughts on how to balance like the benefits of predictive versus some of the ick factor?
So you and I are from the same cloth. We're not going to put up with that. We're not going to have Big Brother overlooking us. And trying to like just in time care and pick up the phone and call us to say, I know something about you that you don't know. Yeah, we're not going to put up with that from that. But it really depends. This is where the social responsibility comes in, the ethics comes in.
Right.
Just because you can do it doesn't mean you should do it, right? From that. And so when you get the data in responsibly, it should be able to give you, when you're overlooking a patient population anyway, it should be able to go through and say, I have 10,000 patients I'm looking at. Maybe Ken needs to be at the top of this list that I make a phone call to, not in a creepy way, but just say, we saw something that we would like to discuss with you. And maybe it's the fact that they didn't renew their meds and take their meds, right, from that standpoint. And they can head off that emergency room or that transportation to the emergency room.
There's so many parts of this that I'm excited to dive into because there are these moments where we do need help with adoption, with reminders, with patterns. And there are these moments where we want privacy and no, that medicine didn't feel good. I'm not taking it again. And I like how the Life 365 approach is like starting to paint in what are those things that are happening in the patient's life that actually would drive them to do one of these things rather than just like they didn't do the thing. Because there's a lot of punitive, like you didn't do the thing. So the show is called the Health Tech Glow Up, and a glow up is a rebirth or a transformation. For the health tech industry, what's the glow up that you want to see happen in the next 6 months?
I want to see the point of care change, right? That's out there. Now, the administration has done a couple of things that are positive over the last couple of months. One of the things is that they said they would really like to see more people wearing wearables and data coming out, right? The other thing is they'd really like to see more in the rural areas because health providers are leaving the rural areas from that standpoint. And with the big, beautiful bill, they put in $50 billion to be able to help with that, right? The White House has already signed initiatives on getting AI more prevalent in our agencies that are out there as well. The things that I discussed we want to do is very much needed to be able to get that to change. We are working in systems in the government right now, especially around our veterans, where they are limited in what they can offer our veterans. From that, they have to send out a scale or a blood pressure. And a lot of times because it's so constrictive, they put it in the last 6 months of a veteran's life. And if you knew it was your last 6 months of your life, would you want to be taking your blood pressure? Or would you want cigars and bourbon and ice cream? So we need to get to somebody much sooner. And so that's why I started calling about, instead of reactive care, it's proactive, preventive, preemptive, prioritized, and personalized. Care has to be personalized to an individual to get them to engage and to adopt it. So me personally, I gave them up my primary care physician probably 6-7 years ago because they'd make me come in for an exam, come back for the test, come back for the results. And that's because they were paid more every time that I would come in.
Each visit.
Major pain for me to do that. It's very clear that consumers and payers are make the decision in this industry and not the providers from that standpoint. Consumers will vote with their dollars and go where it's best for them to go. So we have to make solutions. I want to be able to see, I've got 3 large screens on my desk at home. That's where I want to see my doctor.
What's your 6-month goal and glow up there?
So we really want to help our veterans, right? The agencies are changing. The government's changing. I think we're in a mode where agencies are being broken so they can be fixed, just like NASA was broken to bring in SpaceX and stuff. I think it's a real big time for us to be able to go through and bring in the right technology to get the right outcome to the right patient at the right cost. And this new technology is going to be mandatory for us to be able to get to our veterans and to extend care. So my next 6 months is about the veterans.
Yo, thank you. The last question I have for you, the show this year is themed around heroes and legends. I know that every entrepreneur has heroes and mentors who helped encourage them, inspire them along their way. How have mentors and coaches and your heroes helped your health IT entrepreneurial journey?
Absolutely, because when you see one patient, you've seen one patient. The biggest thing that was taught to me early on was field of dreams. Just because you build it, they may not come. So you've got to have a reason why you're building a healthcare solution in the first place. I think the other thing that mentors have shown me, and the reason why we came up with our platform to connect into the home, is because there are a lot of disparate solutions that are out there. And it's really hard for the health systems to try to implement them. I've had great mentors like Dr. Jay Saunders, who is the father of telemedicine. Jay started this 40 years ago by using a TV and a camera.
Expensive, Cam.
Absolutely. But it was had somebody at home connected. I think it was in John Hopkins they were connected to. I also had Dr. John Long, who was the physician on the Western White House for Reagan. And he basically laid it out straight about how we engage with people out there as well. Just because you've got a degree doesn't mean you're absolutely right.
Every patient knows that.
The people that created the problem can't fix it. It takes a lot of new entrepreneurs to bring in new ways of thinking to make the changes that we're looking for.
Oh, that is amazing. Ken Dix of Life 365. What a fantastic place to leave it there. Thank you so much for all of these fantastic insights. I love that we're putting the patient in the center and changing the paradigm all at the same time.
Yeah.
Thank you for everything you're doing for more personal care. And I can't wait to hear more about this glow up for veterans that you're working on in the next 6 months.
Thanks for helping me and thanks for supporting the initiative as well.
Amazing. Thank you
Man.
so much.
And we're going to clap one more time. 1, 2, 3. Love
There
it.
you
Thank
go.
you.
Hello and welcome to the Health Tech Glow Up. I'm Nathan C. and today I'm talking with Dr. Lior Rauschberger of Gene by Gene. Dr. Lior, thank you for joining me.
Thanks for having me.
Can you get us started by introducing the work that you do at Gene by Gene and what you do there as CEO?
Gene by Gene is a precision health medicine company. We're super passionate about providing genetic data to humans around the world. We're a large accredited cap and clear laboratory, and we do human DNA testing of all formats for lots of companies around the world.
How does that translate into a person like me making decisions about my healthcare?
Once upon a time, I was a practicing doctor,
Uh-huh.
and when I practiced medicine, it was all about a one-size-fits-all.
Mm.
So I'd prescribe someone a certain medication on the same dose and come back and see me in a month to see how you're feeling. And some people had side effects and some people were getting better, and also for diagnosing conditions. So genomics, which has really exploded in the last 10 years in such an exciting way, it is helping doctors or helping humans and give information to give the consent to have a DNA test so that their healthcare providers and clinicians can use that data to help diagnose conditions better, prognosis, medication management, compliance, prevention. Think about that, prevention, right? We want to empower people to say, I have a higher risk of getting this particular condition or coronary artery disease, so I can do things proactively before I have my heart attack or my stroke, rather than it's always a bit later. It's a bit late when you've already got it.
Yeah,
Harder.
damage repair always takes more than prevention, right? Amazing. So the show is called the Health Tech Glow Up. A glow up is a transformation or a reimagination. Let's look at the industry first. What glow ups do you want to see happen in the health tech industry?
At the moment, when you have a DNA test, because it's been quite expensive historically, which has just changed, your clinician or your doctor might order just that little test. And we all inherited 3 billion letters from our parents. And that $3 billion test used to cost, when I started doing this 15 years ago, that test was literally $10 million. Now it's $100. So what I would like to see in terms of really transforming the industry, I would love to see every single newborn child, the day they're born, have their entire genome sequenced, and then they carry that information for the rest of their lives in their own wallet or passport. It's their data, it's their genome, and they make that available to whoever they want to help make better decisions about their health and wellness. That's my vision.
I love this, and apologies for having a potentially critical follow-up. Some of my friends, I don't even trust with their own Gmail passwords. Talk about the safety and security side of a world where everybody has access to their genome.
Yeah, it's a really important point because I think many companies have been cowboys in this space and they shouldn't be trusted. Yeah, and they feel like they take the data from the individual, and I think that data is your data. You own that data. You should have control of that data. in a very secure format, which we'll talk about, and no one else has that data. If you go and see a doctor in 2 years' time or 5 years' time, or you see your pharmacist or you see your personal trainer or dietitian, you can share which parts of your data you want, only with you give them the keys and you take the keys back. And that should be done in your own, or it could be on your mobile device, in a secure wallet. It could be on the blockchain with your own key. And no one else has it, a private blockchain.
Yeah.
And then all those worries about, I don't want anyone else to have my data. I don't know what they're going to do with it. I don't want to be discriminated against. I've had some people say, I'm worried if I give my DNA somewhere, it's going to be stolen from the freezer and planted at a murder scene.
That's a very important person.
That's a very important person. But that's my vision, is that you should own that data and you should control it at all times.
Amazing.
But we're not there yet. We're not there yet.
Yeah. For Gene by Gene, what's a glow up that you're looking to make in the next 6 months for your organization?
We are working on, there's really 3 things that are making testing more accessible: price, turnaround time, and service levels. And so I'm really focusing on the price and turnaround time, because I know that if I can transform the medicine, we're investing in lots of new platforms that we can continue to drop the price, which will allow more genetic research to happen, which will unlock more secrets, and that'll just explode the industry further. So that's what I'm focusing on in my company.
Yeah. Amazing. Barriers to adoption and reducing the cost of healthcare. Like, who doesn't want both of those?
Exactly. Yeah.
Amazing. So the theme of the show this year is heroes and legends. I'm using that as a way to ask people about the heroes and mentors that have impacted their journey as an entrepreneur. I'm curious, how has a mentor or a coach or even just a friend encouraged you on your journey?
The chairman of my business, whose name's actually Dennis Bastis, he's a very successful Australian entrepreneur. He's been a bit of a mentor of mine. What have I learned from him? I'll tell you what I've learned in my entrepreneurial journey, which Dennis taught me, like unwavering grit, like perseverance.
Yeah.
Like, we have changed our business model. We pivoted just to find the perfect product market fit.
Mm-hmm.
A lot of no's until we found a great spot, and we're in a wonderful spot. Grit, perseverance, or persistence. That's big for me. Really big.
Amazing. Dr. Lior, one last question. Do you have a health tech hot take?
A hot take.
Yeah.
Well,
A spicy opinion.
a spicy opinion.
No pressure.
No,
That's some good.
I have a spicy opinion on AI.
Do it.
I think AI is a bit overrated at the moment. Now, I know you walk around this conference and 70% of every stand has those 2 letters in them. In genomics, AI will make a big difference, but I do think it's not going to be everything to everyone, right? And I think there's a lot of noise in the industry. There's still plenty of hallucinations going on, and I still use it every day, but I think you can't just rely on it. I think people are just relying on it to do everything, and I think you still need to read everything it gives you, be a bit distrustful about what it is, and just validate everything. And particularly in my world, in genomics, where we're helping people around things like cancer and heart disease and whatnot.
Dr. Lior Rauschberger, CEO of Gene by Gene, thank you so much for joining me on the Health Tech Glow Up.
Thank you very much. Thank you all.
Amazing. We got one more thing to do.
Yes.
On 3. 1, 2, 3.
Yes.
We did it.
Thank you.
Thank you so much. Hello and welcome to the Health Tech Glow Up. I'm Nathan C., and today I'm talking with Dr. Colin Banas of DrFirst. Dr. Colin, thanks for joining me again.
Thanks for having me, as always.
How is your health this year?
It's good. One day has flown by already, and it's a lot of excitement out here as usual, and looking forward to the rest of it.
Amazing. We had the opportunity to talk on the Tech Glow Up last year. I'm curious, do you remember the glow up that you shared? And do you have anything to report on your progress against it?
If I had to guess, the glow up last year was probably around AI, but am I close? Yeah, we've made progress as a company. DrFirst has actually adopted an AI first culture. So not only are we empowering our patients and providers with AI and automation for all of those things that are driving us crazy, but we also adopt it as a company. So we are actively educating and promoting AI from within the company for pretty much all things, whether it's in documentation, presentations, and coding. Believe it or not, the engineers have flocked to this like candy. It's been an exciting 12 months.
When you say coding, you're specifically talking about computer code and not medical coding?
Like fingers on keyboards, let's code some solutions, not DRGs and ICD-10s.
For those who haven't already met you, can you briefly give us the intro to your work and what you do at DrFirst?
Yeah, I am the Chief Medical Officer for DrFirst. I am an internal medicine physician by training and have been in informatics for close to 25 years now. The intersection of technology at the point of patient care, making it better for everybody involved. I've been through a lot over the course of 2+ decades, as you can imagine. Paper to digitized to electronic records to now the era of decision support and AI. My role at DrFirst really is to help push the envelope as it relates to medication management, medication safety, reconciliation, and adherence and engagement. So how can we get activated patients to get them on and keep them on appropriate therapy? And so that's the mantra for DrFirst. And then I always add on, and let's make the experience as joyful as possible for anyone involved. So that's providers, that's patients, that's pharmacies, all of it. It's exciting. The 6 years at DrFirst have really flown by.
So the show is called The Health Tech Glow Up. I'm curious, what's a major transformation that you're looking to see in the health industry?
So I think that this is the year of patient empowerment glow up. And what I mean by that is whether it's through frustration, increased awareness, expectations that patients have around other industries that they interact with, patients are now more savvy than ever and are pushing the right levers and applying the right pressure to all of the parties involved to say enough. Like, the experience deserves to be better. Why can't it be like ordering my coffee, like changing my plane ticket, like shopping on our favorite marketplace? And you're seeing this pressure, which ultimately I think is coming from the patient. It's being distributed to all of the parties. The vendors are feeling it. The payers are feeling it. Even the legislation is feeling it. So look at some of the things that have happened in the last 12 months. CMS is trying to kill the clipboard, or at least applying the pressure to the vendors. CMS-enabled ecosystem, so taking that interoperability that we are working on with TEFCA and saying, let's put this on steroids. So the good news is empowered patients, activated patients leads to better outcomes. And in this case, I actually think it's also going to lead to transformational change in health IT.
Oh my goodness. Putting patients at the middle is going to drive transformational change in health. I'm going to make that a pull quote for sure. Dr. Colin, you mentioned you've got a glow up that you're looking forward to make this year. Tell us about your goals for DrFirst.
So it's patient activation and engagement, right? That's the glow up that I want to drive. And you're going to see some pretty exciting things from DrFirst within the next 3 to 6 to 12 months. And believe me, it's going to be exactly around what I just gave a rant on, which is patient activation and patient empowerment. And it's going to be fun. It's time to...
Ooh, I'm looking to flip a paradigm in the next 6 months. I love it. Dr. Colin, I've seen that every entrepreneur is typically influenced by a mentor, a coach, a leader, somebody who has said, I believe in you. I think you should keep going. Is there a hero or a mentor who has helped you on your health innovation journey?
Yeah, that's a good question. You don't get 2+ decades in informatics without having a variety of mentors. But I will go back to the beginning, and your audience probably will know this name, but my first informatics mentor and still my dear friend is actually Dr. Alistair Erskine, who was the CMIO prior to me at the academic institution where we both practiced. And he's gone on to do amazing things at Wessinger, Mass General, and even Emory. And now he's in Highmark, which in Pennsylvania. He'll kill me for saying this, but he'll love it anyway. He's the most charismatic and influential leader that I've met. And I used to tell him that he could sell ketchup popsicles to a lady in white gloves in the summertime. And I mean it. So he's a great influence. He's a true visionary in the field. And hopefully he is listening, because this is my shout out to my mentor.
Oh my gosh. I love it. Thank you so much for that. One last quick question. Do you have a healthcare hot take?
Hot take.
No pressure.
I'll tell you, what was it? I'm not sure it's a hot take or if it fits, but my goodness, was Mark Cuban on a tear last night. He gave an impassioned portion of the keynote strictly around frustration in the prescription space. And you know what? That's my sweet spot. That's my company's sweet spot in terms of medication management and removing friction and barriers. And the hot take is he came in hot, and it's worth paying attention because it really is time to flip the paradigm. So it's going to be an exciting 12 months for DrFirst and for Health IT.
Oh my goodness. Dr. Colin Banas, DrFirst, I can't think of a better place to leave it there for this Health 2025 Health Tech Glow of a conversation. Thank you again, and I can't wait to see all the work that you're going to be doing on these multiple paradigm shifts in the next year.
I can't wait to do this again in 12 months.
We'll talk soon. Okay, we got one more thing.
Okay.
1, 2, 3. Okay. Thank you.